Hello everyone, welcome to my channel. My name is Sadiq Abdullah. I am a medical physicist, radiation safety specialist. Today, inshallah, I'm going to take you in a small journey on how we deal with radiation incidents and emergencies in medical facilities. First, we are going to discuss the potential exposures, which will lead us for unintended accidental exposure. There is two main reasons for the unintended accidental exposure, like equipment failure or human errors. We know that we have in the medical application of radiation and radioactive, it could happen in the diagnostic department where we use the x-rays, or in nuclear medicine department why we use both x-ray equipment combined with radioactive material. But the commonly accident could happen in nuclear medicine department, because as we know they are using liquid radioactive materials and it's not connected to a system to stop the radiation after the beam on finish, because it's producing X-ray as it's still decaying. And for that issue, the licensees or the medical city has the responsibility to make measures in order to prevent such an event from happening. And in case if this accidents happen, they have to determine the dose and identify the corrective action to reduce the consequences of it and implement a corrective measure for preventing this accident uh, from occurring. However, according to the PSS, like the Standard of Safety and Radiation Field, uh, we have to conduct a safety assessment at all stages of the design of the facility itself and review the possible events which could lead us for unintended accidental exposure. And we have to list the procedures involving unsealed sources and ask what could go wrong. Like we have to expect what's the worst scenario could happen in that area and try to prevent an accident or a disaster from happening. And after that, we have to present a report to the regulatory body, like the care and to discuss like the facility abilities to reduce the accident from happening, and the internal system uh, to reduce the possible radiation accident. In order to control the radiation potential exposure, we have to follow the procedure for the emergency plan, which is have to be clear, concise, and have to be posted in a visible place. And this emergency procedure should include predictable incidents and accidents and measures to deal with this kind of accidents. And we have to know exactly the responsible team or the response team who will take the action when such an accidents happen. Then as well we have to know and mention the responsibilities of individual personnel in emergency procedure, including nuclear medicine physician, medical physicist, and so on. And we have to install and the equipment and tools necessary to carry out this kind of emergencies. More of the emergency procedure should include the training program for the staff, and we should implement periodic drills on how to deal when a real accidents happen. After that, the recording and reporting system should be available in the department regarding all the minor or major accidents happen. As well, immediate measures to avoid unnecessary radiation doses to patient, staff, and public. As well, we have to measure uh, prevent access of a person to the affected area. So as we know, like some of the accidents could happen from uh, not having a very good restrict on the radioactive area, and the control area should be prevented for only the trained staff to enter. And last, we have to measures to prevent spread of contamination, because as well we contain the radiation accidents in a small area. It's easy to solve the contamination issue. If we assume that an incidents or accidents happening, the licensee's responsibility is to do a comprehensive investigation of the event and produce a report. And this report should include the following point. It should include a description of the incidents by all persons involved, and it should include the method used to estimate the radiation dose received by the involving personnel, and should include the methods used to analyze this incidence and to derive a risk estimation from the data available. And as well, it should include the subsequent medical consequences for these exposed, and the particular of any subsequent legal procedure that may ensue. And finally, it should include a conclusion drawn from the evaluation of incidents and a recommendation on how to prevent a recurrence of such an accident. Now we are going to discuss the safety assessment. The safety assessment of radiation incidents could happen in three categories. First, the patient and the source or worker, and finally the general public. Regarding the patient, uh, the accidents could occur from request and scheduling. Like you can have the wrong patient uh, in the identification of the patient, the information of the type of radioactive materials, and the dose examination. All this could lead to misadministration of uh, a dose for the wrong patient. And the other side, we have the source or workers, like they order the wrong type of radioactive material, or trans the transportation problem, and they have to know exactly this package the real source that they order, or it's different. And the third thing is the how the package is it safe, the transport is safe, or there is any damage in the sources. And the last one we can see here, the radioactive waste, like the sources of radiation could happen from misusing the radioactive uh, boxes for collecting the waste. And as we know, in nuclear medicine, we have two types, like the clinical waste, the normal waste, and the radioactive waste. And if the worker uh, did throw the radioactive uh, waste in the normal trash can, then we will have an accidents or and unjustified exposure for the stuff. Finally, for the general public, we know that the transportation of the radioactive material could be implemented outside a control area, and they use like vehicles to transport the material from the cyclotron site to the medical city. And any type of accidents in the way should uh, should make like radiation incidents or radiation accidents, as well as the storage of this radioactive material. If it's not in a shielded area, it could lead to radiation leak for the public. And as well, the radioactive waste. If we like send the radioactive waste without completing the at least a 10 half-life of the waste to public waste, then we are putting public people for danger because of a radioactive leak in this waste. The misadministration in nuclear medicine could happen from, as we say, from wrong pharmaceuticals more than the identification issue and wrong activity. And to solve this issue, we have to be sure that the consequences of having a misadministration could lead us to an unjustified exposure and increase in radiation risk for the patient and staff, delayed in diagnosis, and because we need to retake the exam for some patient, which will lead us to increasing the workload and increasing the cost and reduce the confidence of doing this type of procedures. And to avoid these accidents and misadministration, we have to increase our safety culture and safety assessment to define critical procedure and emergency situation. And we should uh, make the reporting system answering the when, where, and why questions to have a full reporting on each step of the procedure to reduce the possible error could occurring. Finally, we have to continue doing the initial training for the new staff and a continuous training for the current working staff. As well as we say, we know that there's uh, a dose calibrator in each day nuclear medicine department, and we have to do a calibration of this dose calibrator to ensure that the prescribed dose of the patient is correctly measured and correctly delivered to the patient. There are some accidents could happen in diagnostic radiology or nuclear medicine, which is the if we have a non-known pregnant female. She didn't clarify to the technician that she is pregnant, or she didn't know after he done the radiation. This is we dealing with it as an incident to investigate. That's the beginning. The technologist should notify the performing radiologist who will do the electronic OVR and then inform the safety radiology officer, and he will contact assigned medical physicist for the dose estimation to know exactly how much dose she received. After that, they will report these incidents to the referring physician, and then the patient's consoling should be conducted by a referring physician. After that, referring the patient to obstetric and gynecology department if needed. Now we are going to discuss the radiation emergency internal policy of the KSUMC. Instruction on radiation contamination or decontamination should start with measuring the contamination level, and you can find all the information in the policy at the DR Radiation Protection Unit B/2. Uh, After that, immediately contact the radiation safety specialist to assess the radiation spill and do the decontamination uh, if needed. The decontamination, the area and equipment according to the following. First, we have to put a protective personal equipment and place absorbent paper towel over the liquid spill or towel compound with water over spill with solid material to absorb the radioactive liquid from spreading for a wide area. And then monitor the spill equipment or people involved to know if there is anyone contaminated or any spills in other area. After that, we should monitor personnel after washing repeating if necessary to be sure that he's decontaminated and he didn't have radiation spill on his clothes or something. After that, wash and monitor yourself thoroughly and survey to confirm that the level is reached the background levels. And the instruction for this radiation action, you should be calm and do not panic. And after notifying the radiation safety specialist, then the radiation safety officer will do the following as we know he will do the personal protective equipment preparation and the survey the suspected area using a suitable survey equipment and identify the boundaries of the contamination area to clearly make the hot zone and the cold zone for evacuating the stuff, and after that isolate the contaminated area for long enough for the activity to decay or performing a decontamination if needed. And after that, he will survey the area after he finished the decontamination to confirm that the radiation have reduced to reach the background. And after that, all the response team should report the accidents in details for the management of radiation safety unit and the medical director, and sometimes it could be reporting for the authority like care regarding the accident. It's so important to check the emergency kit to be available in nuclear medicine department to use it when an accidents or incidents happen. And this emergency kit should be kept available for use in an emergency. It may include the following like protective clothes, gloves, and covers and this thing, and it should include the decontamination materials for the affected areas, including absorbent material for wiping up the spills, and the decontamination materials for persons as well, warning notice to make the cold area and the hot area according to the radiation levels at that area in the evacuation. And it's include a portable monitoring equipment uh, most of the time with decontamination survey meter and bags for waste, tape, labels, and pencil. In case of emergencies in nuclear medicine department, all this staff should be aware of the range of this spell. Is it a minor spell or major spell? As we see here, the technetium 99M, if it's less than 100 millicurie, then it's a minor spell. The staff himself can deal with the spell if the area is small, and if the spell is more than 100 millicurie, then we have to initiate the code orange and start contacting radiation safety response team to deal with this kind of radiation. In case of minor spill, uh, the radiation response team they will use a protective cloth and disposable gloves. Quickly plot the spill with an absorbent pad and keep it from spreading. A plastic bag on hold contaminated items shall be available, as well as some damp paper towels. Remove the pad from the spill and then you have to wipe the wipe with the towel from the edge of a contamination area toward the center. After that, we have to dry the area and perform a wipe test and check the test, the wipe radioactivity using survey meter to know exactly the level of contamination and continue doing this cycle of cleaning and wipe test until the wipe sample indicates that the spill is 100% clean and it's came back to the background radiation. In case of major radioactive spill, the the technician or the staff who witnessed the spill should directly contact the radiation safety uh, officer, and he can do like absorbent that maybe thrown over the spill to prevent further spread of contamination. All the people not involved in the spill should leave the area immediately, and all the people involved in the spill should be monitored for contamination when leaving the room. If clothing is contamination, it should be removed and placed in a plastic bag labeled radioactive with the activity that's measured from it. And if the contamination of skin occur, the area should be immediately be washed. And if the contamination of eye occur, flush with large quantity of water. Thank you very much for joining me in this presentation. I will appreciate if you subscribe to my channel and hit the bell and like, and if you have any comments on the this information, I will be more than happy to read your comments below. Thank you very much.